typically has one bowel movement every other day, but this pattern changes from two bowel movement daily to one weekly. She has stopped using laxative because diarrhea resulting in fecal incontinence. Colonoscopy 3 years ago showed no abnormality. She has MDD with anxiety treated with sertraline and lorazepam. She does not appear to be in distress. Temperature is fine, pulse fine, respiration fine, BP high. Abdomen is soft, non-distended and non-tender. Bowel sounds are decreased. Rectal exam shows no masses or stool. Test of the stool for occult blood is negative. Which of the following is the most appropriate next step? Mm, mm,
What do you think? What is your diagnosis?
I don't know. It's like it's not
You
small bowel obstruction. It's probably like
He has
large.
constipation, and you have
Um,
done everything, like you have done colonoscopy, and she has another thing, like she has anxiety problem, like MDD with anxiety. So she is on, like she is on sertraline and lorazepam. If we think
oh,
like IBS,
oh, okay. Damn.
IBS is a disease of exclusion, isn't it? So uh, saw the they saw the colon, they saw the rectum.
Okay. So just trial of fiber supplementation. F.
Maybe
Does it doesn't make sense, but okay. I guess F. Okay.
she has stopped using laxative because of diarrhea. So so
Yeah.
she has constipation alternate with the diarrhea. So
Okay. So F. Okay.
okay,
Yeah, is F.
okay, F is the right answer. Okay, I'm reading the explanation.
Mm-hmm.
Like IBS, irritable bowel syndrome, diagnosed by using the Rome 4 criteria, which includes the presence of abdominal pain at least once weekly. Abdominal pain at least once weekly. That is associated with generally relieved by defecation, along with a change in the stool appearance or a stool frequency at least 2 or 3 is required. IBS is further subdivided into IBS with constipation, IBS with diarrhea, or mixed IBS. IBS presents with intermittent abdominal pain that is relieved by bowel movement and associated alterations in bowel habit with intermittent episodes of diarrhea and constipation. Stress management may improve bowel habits in patients with IBS, which is often associated with concomitant anxiety. In this patient, fiber supplementation may help with constipation and improve regularity of bowel movements. Features that are no Features that are suggestive of underlying organic pathology rather than IBS include the presence of occult blood or melena, nocturnal diarrhea, worsening abdominal pain, weight loss, or a family history of the IBD or colon cancer. Do you want me to read another options too?
Yeah, B and C.
Oh, okay. CT scan of the abdomen and the pelvis would be appropriate. CT scan of the abdomen of the pelvis would be appropriate in patients with acute abdominal pain, and abdominal examination are concerning for intra-abdominal pathology, such as in this patient with fever, focal abdominal tenderness, rigidity, rebound tenderness, or peritonitis, it would be less helpful in a patient with chronic abdominal pain than a benign abdominal examination. And discontinuation of the lorazepam or sertraline may be harmful in this patient as IBS has been associated with stress and anxiety. Okay.
Okay, next. Previously healthy 4-year-old girl brought to the physician because of sore throat and temperatures that are high over the past 24 hours. She attends school and several other students have similar symptoms. She appears ill. Exam shows redness of tonsils with exudate. The reminder of the exam is fine. Rapid strep antigen is negative, but throat culture goes strep pyogenes. Which of the characteristics of the rapid strep antigen test best explain this result? Mm, low negative predictive value, negative test, and patient don't have the disease.
Like a streptococcal antigen test, isn't is this like sensitive test, isn't it?
It's sensitive, but I think it's not specific.
Okay.
Patient disease, positive test patient. It's between B and E. B as in boy and E. Yes, it's E. Okay, let's see. Are you done? You pick one.
Yes.
Okay.
You can give your answer here. Like you can highlight your answer
Right.
if it is wrong.
Oh
Then you
no.
can, yes.
Right.
Like we are solving.
Mm-hmm, mm-hmm. Oh, wait, which one did I pick?
You pick
Oh,
low specificity. So it is wrong.
never mind. Shit. Mm. Okay, read it.
Okay. I don't know why it is low sensitive. Okay. The rapid streptococcal antigen test. The rapid streptococcal antigen test results in this case of streptococcal pharyngitis are best explained by low sensitivity of the test. Sensitivity is the ability of a test to detect a disease if it is present. A test is described as sensitive if it has high likelihood of disease detection. If it has high likelihood of disease detection and therefore a low likelihood of a false negative. A test with poor sensitivity, if negative, does not provide strong evidence or confidence that the patient does not have the disease. In contrast, a highly sensitive test allows the clinician and the patient to be confident that a negative test means that the patient is disease free. In the case described, the rapid streptococcal antigen test demonstrate a low sensitivity and is of limited use of the physician for ruling out of streptococcal infection. However, the test is useful because if positive, it will prevent a more expensive and involved test from being required. Okay, why it is not low specific? You understand this?
Mm, barely.
Okay, then make me understand.
Barely. I'm saying that because usually they start with the strep, rapid strep, and then this is positive, then they go, wait, how
And
they do it in that
another
subclinical?
thing I want to tell you, like whenever you are doing questions,
Mm-hmm,
you can take the help of the uh, when you are doing alone, you can take the help of the AI, like you take your phone, like if you use Gemini, Gemini
Mm-hmm.
has a option like you can go live. It can be done through phone, that Gemini can tell you to go live. When you go live, you can open your camera, and if you put your camera towards your screen, like you are doing the question here, and you can tell the Gemini to read the question, and you can tell the Gemini that can you explain, like, then
What?
he can, some extent, he can give you a good explanation. Sometimes it got wrong because they do not provide you the medical explanation, so sometimes it got wrong, but most of the time it is right. So as I am using it, so I am telling you this,
Hmm.
like it is, like when you are doing alone, sometimes we are getting disturbed or fed up, so
Yeah.
you tell Gemini to read the question and he can
So
help you for reading the
I have
whole
to
question.
download the on my phone.
Sorry,
So I have to download the app Gemini app on my phone,
Gemini.
or I just
Yes, yes.
how
You
does
have
that
to.
work?
You can
Download
you
the app on my
yes. You
phone.
have to download, and there is in the right side there is an option like some buttons. Click here, then your phone will go into live. There is an option to open camera. Just open the camera and put the camera into the your screen,
Mm-hmm.
like doing a video recording. If you just put your phone in a stand and you can do it easily. You got my point?
Which check your WhatsApp. Which one is it? The
Yes,
Google
Google
Gemini.
Gemini. Yes,
Or Gemini. Okay. Okay. I'll try it when later then. Let me download this
it is
while we go.
helpful. That's why I am
Yeah.
sharing these things. Like,
Yeah, because the question yesterday, I was like, the answer is not on the answer key. So how do I know?
yes, just what you need to do is to just in like you are doing CMS form and you haven't found the answer, just copy and paste your whole question in the CMS form. It will give within a fraction of second. You need not to waste your time.
Mhm.
Most of the time it is correct, but
Okay.
there are some clinical explanation that may not be correct, and it is improving.
Okay.
You got my point?
Think with it. Yep. Yep.
Like, there are some questions you need just a clue, just a simple clue, the explanation, like previous day you have found it. Okay,
Okay.
I'm talking a lot.
No, thank you. That will help me.
No, no, this is the tips and tricks, as we need to like share our thinking, like people are improving, people are using AI,
Mhm.
and
Mhm.
if we are lag behind, it would be it is not good. We should update with the recent information. Okay, you want me to read the other options too, or
The
you
loss.
can explain the why it is low sensitivity? I don't get it. I
Oh.
have found that it is sensitive, but why low sensitivity?
Oh, they're saying that because high sensitivity will mean that when the test is positive, okay, let me say it right. When the test is positive, then you are sure that you have the disease, and you are sure that the patient have the disease, so you don't have to use a specific test. You know how this
Like ANA,
like
anti-nuclear
like
antibody for SLE.
maybe, or the D dimer and the CT angiograph. You do
Okay,
the D dimer. If it comes positive, then you don't need to do the CT angiograph because you know the patient has it. For at least for low risk, whatever. But when it's
like if D dimer is negative, it means it rules out the DVT. But if D
yeah,
dimer
rules
is
out the
positive, it does
Uh-huh.
not mean always that the patient has DVT. Is it? Isn't it?
Exactly. Kind of, yeah. But that's if the patient is low chances of having DVT, and you do the D dimer and it's negative, then you can rule out the patient don't have DVT because he has low probability, you know. But what if the patient has high chances of having DVT, and then you do the D, well, you're not supposed to do the D dimer at that point, but let's say you do the D dimer and the D dimer comes negative. Are you going to trust the D dimer at that point? That's a high probability of the patient having DVT. Like he's a high risk of having DVT. And you do D dimer and the D dimer comes negative. Are you trusting the D
No,
dimer?
no.
No, probably not, right? You shouldn't even start with the D dimer. You should go straight to the CT because he has high probability of having DVT. I think that's what they're trying to say here. Now I don't know how they word it. It's weird, but I think that's kind of what they're trying to say here.
Okay.
Can you read E?
Yes. Low specificity describes a test. A low specificity describes a test that is subject to false positive errors, meaning that a positive test does not have the positive test does not have the likelihood of disease. This is not the case here, as the rapid streptococcal antigen test gave a false negative, not a false positive. High specificity is required in order to confirm the diagnosis. An example of high specificity test for streptococcal pharyngitis would be throat culture.
Jesus, this question is getting harder. Okay, let's go next. 42 woman comes to physician because of 1 day history of severe pain, swelling, and warm. Pain, swelling, warm in left knee. The pain is moderately relieved by ibuprofen. She knows that um, she awoke with the pain 1 day after she did an aerobic kickboxing workout. Temperature is fine, pulse is fine, BP fine. Upper aspect of the left knee is red and warm to the touch with an infusion. Range of motion is limited by pain. Reminder of the exam is fine. Which of the following is the most appropriate next step in management? Red, warm, swollen.
In the knees, erythematous and warm to touch.
He
Fusion.
has all that, but he doesn't have fever,
But look like septic arteries, isn't it?
right? But without the fever. So we just do the arthrocentesis, I guess.
Arthosynthesis, maybe.
3E.
Okay.
Okay, yeah. Can you read?
Yes, pseudogout results from calcium pyrophosphate crystalline deposition within the joint space and may manifest acutely following trauma, surgery, or extreme exertion. Crystalline deposition provokes an inflammatory response the leading to the classic presentation of the joint pain, erythema, effusion, calor, and a reduced range of motion. Pseudogout most commonly affects the knee. Arthosynthesis is both therapeutic and diagnostic as it follows for the sampling of the synovial fluid that may show the presence of calcium pyrophosphate crystals and increased concentration of leukocytes. Additionally, arthosynthesis is necessary to rule out the presence of septic arthritis or hemarthrosis given the patient's presentation of monoarticular erythema and swelling. These competing diagnoses cannot be excluded on point-in-time clinical features alone. Plain film X-ray may show chondrocalcinosis and the degenerative joint disease. First-line medical management include NSAIDs and colchicine.
Can
Okay.
you read B?
B. Yes. Application of knee brace and eyes and elevation are useful supporting measures, but they are less effective at reducing pain in pseudogout than arthrosynthesis. They also do not facilitate diagnosis or exclusion of alternate diagnosis. This would be an appropriate initial treatment in knee sprain, ligamentous or meniscal injury, or traumatic hematosis.
Healthy 14 girl brought for routine. On questioning, she says that she has been sexually active with her boyfriend of 6 months. She said that she used condom consistently and she takes OCPs. She has smoked one pack of cigarette for 1 year, drinks beer or wine, not that much. Physical exam shows no abnormality. Which of the following is the most appropriate next step? Then A and B. Inquire her addicted to smoking and health. Attitudes towards smoking and health. Maybe inform her about the long term. Okay, you ready?
Yes,
Okay.
so it's B.
Mm-hmm.
The most appropriate next step in the management. The most appropriate next step in the management of the patient is to open a discussion about her use of cigarettes and alcohol by inquiring about her attitude towards smoking and health by starting the discussion with an open ended question. The physician will gain insight into the patient's motivation for smoking and the patient's overall understanding of the impact of smoking on her health. This will allow the physician to direct the conversation further in a way that is most likely to garner change in the adolescent. The physician should be direct and clear in explaining the risks of smoking without making the patient feel guilty or defensive. Motivational interviewing, a technique is in which physician determines the patient's willingness or motivation to change may also a helpful strategy. Okay.
Okay. Next. Healthy 52 woman comes to physician because she's concerned about her risk of developing thyroid cancer. Her father was just diagnosed with papillary carcinoma of the thyroid. She takes no medication. Exam shows no abnormality. Which of the following is the most appropriate screening test for this patient? Mm, mm, Just palpation, I think. Doesn't make sense, but
There is no nodule. If there is nodule, there would be like TSH or ultrasound, isn't it?
yeah,
So
yes. I
he
mean,
has only the family history. So we need to find out anything is present or not. Why we will do the add in 131 and antibodies and ultrasound.
right? Or do
Yes.
we do the no?
No, no.
Five, okay.
So this type of question we will do mistakes in the exam because the palpation of the thyroid gland does not make any sense.
Hmm. It doesn't. I was like, I never seen. Yeah.
Yes.
Okay.
The most appropriate initial screening for thyroid cancer, thorough history and physical examination directed toward the identification of the palpable thyroid nodule. palpable thyroid nodule, regional lymphadenopathy, and vocal hoarseness. Following a physical examination, evaluation of serum concentration of the thyroid stimulating hormone may disclose a normal or increased TSH concentration in the setting of non-functional nodule. Hyperfunctioning nodule are rarely malignant and may be detected via decreased TSH concentration with a radioactive scintigraphy. Large or non-functional nodule may require a biopsy with a fine needle aspiration.
Okay. Next. 16, college student comes to the physician because of 3-month history of cough that occurs only in mid-afternoon and evening and is not associated with any other symptoms. Okay. The cough seems to be somewhat worse in cold weather but does not wake her from sleep or prevent her from performing her routine things. She has no personal family history of medical disease. She has never been hospitalized. Exam of the X-ray. Exam and X-ray of the chest shows no abnormality. Um, the diagnosis only mid-afternoon and evenings. No other symptom. Hmm.
Worsen cough, cold weather, nothing prevents him from routine activities.
I think that makes sense with that. I don't know. But the fact
GPA
that it's
has like lungs, kidney, uh,
right, it's
yes, and upper respiratory tract.
lungs, kidney. It cannot be that.
It
Um,
is either TB, 3 months
but
cough.
the TB,
Sarcoidosis should be other features too, like not only the cough syndrome, there may be uveitis, there may be rheumatoid arthritis like feature. I think the TB or polyp. You are thinking about asthma,
because TB, I feel like you will see something on chest
fever.
X-ray,
Yes, yes, chest extra. So TB
and
is
then
not.
vocal cord polyp, vocal cord.
But
So why
like,
would only
sorry,
for vocal cord polyp? Why will it only happen in the afternoon, in the evening?
because maybe he's a singer. Like vocal cord can be used like if it is asthma, it should be morning cough, isn't it?
No, I thought asthma was worse at night.
Yes, it works at night or in the early morning. There is cough, so it
Okay,
is not asthma. May not be
don't. Okay,
that
you think it's vocal cord polyp?
other does not make sense.
Yeah, the
Co-
others don't make me.
cocaine, like cocaine would be like nasal crust or something like that.
Yeah, it doesn't make. Why would they get worse in the cold weather? It
So
just
you are thinking asthma. Maybe I don't know.
I don't know. I'm kind of
You
lost
are
on that one.
right.
Yeah, it's the only thing that makes sense.
Yes. So it is asthma. It is cough variant asthma. Is the most likely diagnosis in this patient. Asthma often presents with episodic wheezing, shortness of breath, with or without cough, but it but it cannot present with ice, but it can also present with isolated cough. Patients should be assessed for other atopic like allergic rhinitis, eczema, and these conditions are commonly occur in conjunction with asthma. Other causes of chronic cough like GERD or rhinosinusitis. Patients in whom asthma is suspected should undergo spirometry with measurement of 1 second forced expiratory volume FEV1 and the FVC. As asthma is a reversible and episodic condition, spirometry is frequently normal unless patient is exhibiting symptoms at or around the time of the spirometry. Therefore, most patients undergo methacholine challenge stage. Methacholine is a potent stimulator of the bronchoconstrictor, as the asthma is defined by airway hyperactivity. Patients with asthma tend to experience bronchospasm at a lower range of methacholine that than patients without asthma. An improvement with FEV1 by at least 12% or 200 ml with the bronchodilators is diagnostic of the asthma. Okay. And treatment depends on the severity but may include short-acting bronchodilator and inhaled corticosteroid. Okay, why it is not vocal cord polyp? Vocal cord polyp can cause hoarseness, not cough. Okay.
What is it? Oh, horse okay. 82 men brought to the physician by his daughter because 6 month history of memory problems and strange behavior. He lives alone. His daughter says that 4 times during this period she has found him wandering around the apartment naked in the middle of the day. She took his car and car keys 2 months ago to prevent him from driving because he repeatedly became lost while driving home from the grocery store. He has a history of head injury at the age of 14. He has hypercholesterolemia, hypertension, taking simvastatin and diltiazem, paternal grandmother at dementia Alzheimer type. The patient has an A grade education, vital signs normal, physical exam shows a slow but normal gait. Mental status exam, he describes his mood as okay. He appears irritated at having an appointment but is friendly. Mini mental status is 22. Which of the following is the next step in pharmacotherapy? So, what medication? Between D and E, donepezil.
Is it like Alzheimer disease?
It kind of looks like Alzheimer's, so it will be the wait,
Alzheimer, like
donepezil.
Alzheimer with dementia, donepezil may be the drug of choice.
Okay, ready. Yeah, yeah.
Okay. Dementia Alzheimer type is associated with decreased cerebral cholinergic signaling. Decreased cerebral cholinergic signaling. Treatment with cholinesterase inhibitor such as donepezil and rivastigmine, is helpful by improving cholinergic signaling and results in symptomatic benefits including improved cognition and reduced neuropsychiatric symptoms. Cholinesterase inhibitors do not result in neuroprotection and do not alter the underlying disease course of dementia. Alzheimer type cholinesterase inhibitors enhance vagal tone and are contraindicated in N-methyl deaspartate receptor antagonists such as memantine, which does result in neuroprotective effect by limiting glutamate induced excitotoxicity. Okay.
Okay. Mm, next. 23 woman comes to physician because of moderate pain and swelling in her right ankle after twisting it yesterday. She has no history of serious illness, doesn't take medication, vital signs normal, exam shows moderate edema of the lateral aspect of the right ankle and ecchymosis below the lateral malleolus, and tenderness to palpation of the anterior aspect of the lateral malleolus. Okay, ecchymosis below. Okay, the posterior aspects of the lateral and medial malleola are not tender. Neurovascular function of the ankle is fine. The patient can bear weight as she walks across the room, but has been using a set of crutches. In addition to recommend the 2-day ice pack application to the injury, which of the following is the most appropriate next step? Oh, it's those rules, those weird rules that I never remember. This one. Probably those weird Ottawa rules. For some reason, I never remembered that thing.
L- like Ottawa ankle rules.
Probably, yeah. It's
O-
probably that. I never remembered the rules thing either.
In Ottawa ankle rules, X-ray is usually done.
For what? Which? That's the thing. Is the rule for when
X-ray,
it's below.
I like X-ray in the ankle and X-ray in the foot. There is no X-ray in the foot, so only X-ray in the ankle is present. Yes, in the rule they are. Okay, I forgot. I need to see it.
I forgot. That's what I'm saying. There is weird. For some reason, I can never remember those rules.
But we
Okay.
both are wrong.
It's weird. No. Oh my God. So it's not the rule. Okay. Read. Read.
Usually, it comes with the rule. According to the auto ankle rule, they told you to first to do X-ray to rule out is it the either it is X-ray of the foot or it is X-ray of the ankle. Okay, okay, I am
Okay.
reading the explanation now. Oh, use of a protective brace and early range of motion exercise. Use of a protective brace and early range of motion exercise is most appropriate next step in the management for the patient who most likely has ankle sprain. Twisting injuries of the ankle are common, are more frequently result from investigations in most frequently results from inversion injuries to the lateral ankle. The most important step in evaluation of the ankle injuries is to determine if the patient requires imaging to rule out a clinically significant fracture. This can be done in the office setting by applying Ottawa ankle rules. If there is pain in the malleolar region, or as in this patient, an ankle X-ray is required if there is pain with palpation of the posterior edge or tip of the medial or lateral malleolus, tenderness at the base of the fifth metatarsal or the navicular bone, then imaging is warranted. This patient has anterior pain of the lateral malleolus and is able to walk by herself. Thus, she does not require imaging and should instead receive a soft protective brace to stabilize the ankle followed by early movement when able.
Oh my God. Okay. So if there is pain at the back or at the tip of the malleolus, or if there is pain at the midfoot or at the base, uh, um, a base of the fifth metatarsal or the navicular bone. Okay.
So,
Can
so,
you read?
so
Oh,
according to the question, like where is the pain? If
the
we
pain.
specify,
The pain is at the front. It says right here, anterior aspect of the lateral malleolus. Anterior.
okay,
For Ottawa, it has to be at the back of the lateral malleolus. You see, and here they specify the posterior aspect is non-tender. So they specified it to tell you that it's only the anterior aspect that's tender. So that's why the Ottawa rules and that told you those rules are weird. It's like so specific.
yes.
It's, yeah.
So if
Okay, you
pain in the anterior aspect of the lateral malleolus, but posterior aspect is posterior aspect is tender free, then we need not to do any investigation.
exactly. Exactly.
Okay.
Can you read B and D?
Yes. X-ray of the ankle to rule out fracture are not required in this patient with pain only in the anterior aspect of the lateral malleolus and the ability to walk across the room. Okay, the patient can bear weight. Like how can bear weight? Like he can walk. That means the bearing weight. I
Mm-hmm.
don't understand these type of words like patient can bear weight.
That means that he can put, like, he can carry something and walk, and he doesn't have pain.
In the foot, what you need to carry.
Like, I like how you asked.
Be specific. I don't understand. That's why I'm asking this type of questions because these things goes over my head.
Oh my God, I like how you asked. But you know when you put your foot on the floor, your foot is supposed to carry all your weight from your body up. So it's carrying all the way from your hands, your chest,
L-
everything. So
okay, if like I can stand, that
yes,
that it means
yes,
without
you can stand on
anybody's
yourself.
without anybody's
Uh-huh.
help.
And you can walk without anybody's head, and your foot is not in pain. Yeah.
Okay.
Okay.
Okay, I'm reading the Ottawa ankle rule. Ottawa ankle
Okay.
rule, it is not here. You can Google it. Ottawa
Mm-hmm.
ankle rule is the extra of the ankle is required if extra of the ankle is required if there is pain at the malleolar zone and tender at the posterior margin or tip of the medial malleolus or tender at the posterior margin and tip of the lateral malleolus and unable to bear weight 4 steps like two on each. So this for extra of the ankle and for extra of the foot pain at the midfoot zone or and tender at the navicular bone or tender at the base of the fifth metatarsal or unable to bear weight 4 steps two on each foot. Okay.
Whew. Okay. So at the back and at the tip. Okay, got it. Oh, can you read D as in dog?
Yes. Yesterday was the uh, World
What?
Donkey Day. Truly. Okay. Splinting of the ankle, splinting of the ankle, and referral to an orthopedist would be appropriate if there was suspicion for fracture, but splinting is unlikely to help ankle sprain and will make it more difficult to mobilize the ankle early.
Mm, next.
Okay.
A previously healthy 27 woman, gravida 2 para 126-week gestation, come for routine prenatal temperature fine, pulse fine, respiration fine, BP fine, physical exam fine, except for ecchymosis in various stages of healing over the forearms and lower abdomen. Okay, the fundal height is 27, so it's fine. Cervix is long and closed, and the uterus is non-tender and firm. Fetal heart tones are normal. Hemoglobin, maybe that's a bit low. I don't know. Sure. Platelet is fine, and bleeding time is 6
High.
minutes. It's high. What's the normal bleeding time?
No, no, no. 4 to 8 minutes is the normal. Maybe
Okay,
normal.
that's not okay. And hemoglobin is normal too. Is it?
Sorry.
Is it?
Hemoglobin
Hemoglobin is
hemoglobin is quite. Okay, for 26 weeks of gestation, isn't it?
Okay. Um, Immune thrombocytopenic purpura. And really preeclampsia, no feed, no good. Won't believe one disease. You said bleeding time was fine.
You need,
Uh,
you can see the bleeding time too.
um, what do you mean? Is
Like
the bleeding time on the lab values on the lab value thingy? No, it's not.
in here, no, it is not present here. You can open the UWorld and see the bleeding time.
Mhm. Let me see. Hemoglobin, I believe, is fine. Yeah, hemoglobin is fine. Okay, so it's probably domestic. Just domestic abuse. Okay. Ready?
Mm, okay,
Okay.
okay, it's domestic abuse.
Mhm.
Domestic abuse is most likely explanation for distribution of bruising. Distribution of bruising. Domestic abuse should always be considered in patient with suspicious pattern of bruising or explanation of the mechanism of the injury and do not match the physical examination finding. Areas of bruising are particularly worrying include lower abdomen, posterior rib cage or head. The forearms also be bruised while employing defensive movements to prevent injury to the face or torso during the attack. All patient with such physical examination should be asked in a tactful and non-threatening manner if they feel safe at home. If possible, all patients should be assessed alone to prevent intimidation that may occur with abusing partner. If patient experience that they are being abused, it is the provider's role to assess whether or not they are prepared to act. Often patients are not willing or able to leave a violent relationship, and understanding this requires empathy on the patient on the part of the provider. However, all patients should receive assistance with devising a safety plan, which includes identifying a place to flee if necessary, signaling to children or neighbors who can call for help, and preparing an emergency kit stored outside home with necessary items that might require if the patient should if the patient can call for help. Preparing an emergency safety plan which includes the mm, okay, many states many states require mandatory reporting for the abuse of the children and the elderly and the disabled person, but requirements for reporting the abuse of the adults varies by state to state. Okay.
82 woman comes to physician because of difficulty sleeping at night for 6 months. She says she watches TV or listens to radio at night because she cannot sleep. She has daytime fatigue and takes frequent naps. Husband died 3 years ago and she lost her pet dog 11 years and 8 months ago. She had a weight loss, like 12-pound weight loss since the last exam 6 months ago. She BMI is fine. 5 foot tall, temperature fine, pulse fine, respiration pretty low. BP is high. She appears disheveled and has cracked chapped lips. Physical exam no abnormality or mental status. Her eye contact is poor. She answers questions with delay, short responses, and has difficulty finding the right word. She describes her activities during the past few days vaguely after being asked for specific details. When asked to draw the face of a clock and indicate 1:30 on the drawing, she requires 5 minutes to complete the clock face. She must be reminded that she was told to indicate 1:30 when she then proceeds to do correctly, which she then proceeds to do correctly. She can recall 2 out of 3 objects after 5 minutes. Which of the following is the most appropriate next step in management? Mm, mm, mm. Mm, okay.
I
You
think that
ready?
there is no memory problem, isn't it?
It
She is
looks
just,
like
it looks like memory
it
problem.
looks like no, it looks like she doesn't
She's,
have it.
it
But
looks like she's sad.
yeah, but what about I guess the chapped lips and the cracked lips and all that?
Like when we are disturbed, we can do that.
Okay, okay.
Okay.
Nice. Where is it then? Okay.
So it is MDD. Okay. This elderly
Mm, okay, where was that? Okay, you were reading the explanation for that one.
okay. This elderly patient who raped this elderly patient this elderly patient with difficulty sleeping, weight loss, and behavioral and cognitive changes is likely experiencing a major depressive episode. Major depressive disorder requires the presence of at least 5 out of 9 criteria. 5 out of 9 criteria according to the DSM-5 for at least 2 weeks without an organic cause or symptoms diagnostic of other mood or psychotic disorder. The symptoms criteria include sadness or anhedonia, at least one of which must be present, plus feelings of guilt, energy changes, difficulty concentrating, appetite or activity changes, psychomotor retardation, sleep disturbance, and suicidality. Treatment for major depressive episode involves influencing the action of neurotransmitter along with the therapy. Some medication used include SSRI such as sertraline, whereas others block both serotonin and norepinephrine reuptake. Serotonin and norepinephrine reuptake inhibitor and tricyclic antidepressant. Okay,
Okay, can you read um what
it's
was it
B.
already? B and D. B
Okay,
and D.
recommending grief counseling would be appropriate for patient. Recommending grief counseling would be appropriate for patients experiencing grief reaction. Uncomplicated grief can include sadness, guilt, difficulty concentrating, preoccupation with thoughts and memories of the decreased or neurovegetative symptoms such as sleep, appetite, energy changes without meeting the criteria for MDD. Acute grief would be unlikely in this patient as it typically lasts less than 6 months. And donepezil is a cholinesterase inhibitor that non-competitively and reversibly inhibits anticholinesterase activity, increasing the amount of synaptic acetylcholine available for neurotransmission. It is used in the management of dementia Alzheimer type and may slow the rate of the cognitive decline and modestly improves functionality. Although this patient presents with cognitive decline, this is associated with mood. This is associated with a mood disorder. So, education. Okay, next.
16 girl brought to physician by her parents because she has become increasingly withdrawn during the past 5 months. She quit the swim team and no longer is enjoying spending time with friends. Parents report that she was previously an honor student, but her grades have dropped to C's. When questioned about her behavior, she said that she's tired and her stomach hurts. She sleeps 10, 12 hours each night and takes a nap after school most days. 12-pound weight loss during that time that she attributes to decreased appetite. She reports that she is not concerned about her weight loss and is not intentionally dieting. She often has nausea after eating. She says she's not depressed or upset about anything, but she becomes tearful when discussing her physical symptoms, saying, maybe I have mono or something. I'm just so tired. She has not had fever, sore throat, cough, or diarrhea. Menstrues regular 28 days interval. Last menstrual period. Oh, Lord. Last menstrual period was like a month ago. Um, and she reports that she. Why is my thing like that? Oh, I haven't put this. That's why. Never mind. Okay. Why is not working? Huh? It's not working. Some reason. Okay. Okay. She has not had fever, sore throat, or anything. Menstrues occur at 28-day interval. The last menstrual period was 1 week ago. She reports that she drank alcohol once at a party. She does not use drugs. She has been sexually active with one male partner for the past 6 months. And she usually uses condoms. She appears tired. BMI is fine. Temperature is fine. Pulse is fine. Respiration fine. BP low. Non-lymphadenopathy, abdominal exam fine. Hematocrit, I do not know. Leukocyte count is fine. Which of the following is the next step? Hmm, 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 hmm. 1 week ago.
So, urine pregnancy test would be not the answer because our last menstrual period is 1 week ago, isn't it?
Yeah. Okay, I'll go with. I cannot highlight anymore. I don't know why. Why is not getting me highlight?
Is it thyroid?
Yeah, that's what I was going to go for. Let me close this and open it again. Which one was that? Questions. Okay.
We both are wrong.
Wait, it's not how you said it. Um. Okay, we both are wrong. Okay, where is it? So if it's not thyroid, then it's a suicide thingy.
Yes.
Yeah, I was between those two. Mm.
Okay. The adolescent patient who presents with sleeping dysfunction, weight loss, decrease in the adolescent patient who presents with sleeping disturbance, weight loss, decreased energy, loss of interest in activities, is likely experiencing MDD, major depressive disorder. MDD requires the presence of at least 5 out of the 9 criteria, less 5 out of the 9 criteria for at least 2 weeks without an organic cause or symptoms. Diagnostic of other mood or psychotic disorder. The symptoms include sadness or anhedonia, at least one of which must be present, plus feelings of guilt, energy changes, difficulty concentrating, appetite or activity changes, psychomotor retardation, sleep disturbance, or suicidality. All patients with major depressive disorder should be assessed for suicide risks such as depression. Increase the risk of suicidality. Risk factor for suicide mm, include male sex, young adult age or elderly age, depression, alcohol or drug use, lack of support, prior suicide attempts or organized plan or stated future intent. Treatment for a major depressive disorder involves influencing the action of neurotransmitter along with the therapy. Some medication used include selective serotonin reuptake inhibitors such as sertraline, others block both serotonin or norepinephrine reuptake SNRIs, selective serotonin reuptake inhibitors, and tricyclic antidepressants. Suicide is the greatest immediate risk and is depressed patients. Any patient at moderate or high risk Any patient at moderate or high risk requires immediate medical or psychiatric intervention, potentially hospitalization. Okay.
Next page. 77 men physician because of what 4 week history of moderate severe aching and morning stiffness in his shoulders and hip. He has difficulty getting out of bed in the morning, reaching over his head because of the pain during this period. He has had low grade fever and generalized fatigue. The exam shows decreased range of motion of the shoulders and hips. There is no joint muscle or muscle tenderness. Okay. His ESR is, I guess that's high. Which of the following is the most appropriate next step in management? ESR is high, right? I think. Morning stiffness.
Is it PMR?
Um,
Polymyalgia rheumatica?
Probably. I don't think it's methotrexate. It's rheumatoid. Sorry, arthritis.
Sorry.
I don't think it's rheumatoid arthritis. Definitely not. So we think it's PMR. Then it would be prednisone
Yes.
therapy. Okay.
Age more than 50, ESR more than 50. There are two differential. Like if there is headache, then I think that it may be
Okay.
GCA, giant cell
You,
arteritis or temporal arteritis. If
you
it
is
comes,
right.
sorry,
You are right.
okay. Polymyalgia rheumatica is an anti-inflammatory rheumatic disorder that occurs in elderly, often female patients, and is characterized by stiffness and aching of the proximal muscles and joints of the neck and shoulder, torso, hips, which is more prominent in the morning. Patients often also display signs and symptoms of systemic inflammation, including fever, chills, malaise, fatigue, increased serum concentration CRP, increased ESR. Patients with PMR at increased risk for developing giant cell arteritis, which often coexist with PMR. Patients should undergo a thorough examination to exclude the presence of giant cell arteritis and should be counseled about its symptoms such as headache, jaw claudication, temporal tenderness, amaurosis fugax. The initial treatment of PMR includes oral corticosteroids such as prednisolone, which is often required for a prolonged course, usually 1 or 2 years. Okay.
Is it 56 woman comes to physician for routine in October. She has type 2 diabetes, well controlled with metformin, vital signs normal, exam normal. The patient says she does not want to get flu vaccine this year because she knows people who have come down with the flu because of the shot. Which of the following is the most appropriate physician response? Jesus, all the answers are weird. Like what? Like what? When they receive the vaccine mistaken antibody, you should get the vaccine. Ah, like I said, I like to sign okay, I'll go with this is the only one, but they all sound so weird. Um, okay, done.
Yes,
Okay,
D probably the answer.
it's the only one. All of them sound like he's forcing her.
No, no, he is saying that you should get the vaccine.
Yeah. Yeah.
Like doctor will not gonna say the please, the first one, please take the. It is like begging.
Mm-hmm.
Okay. In our country, we say that it's your wish, whatever you choose. Like nobody,
Even here.
like nobody takes the influenza vaccine.
Oh, because it's not common over there, right?
It is very
The-
common.
Oh.
Every year, most of the people got the influenza, but as everything is easy, so they don't care about the influenza.
Oh. Well,
Okay, the physician should respond. The physician should respond to this patient by addressing her concern in an accurate yet polite, non-judgmental way, followed by a concise recommendation. In this case, patients who are incubating the influenza virus, when they receive the vaccine, mistakenly attribute their symptoms to the vaccine. You should get the vaccine is the most appropriate response when responding to the patient's question. The physician should answer accurately and without bias. The physician response should foster an environment in which the patient feels comfortable asking for future questions. In this case, the physician response should also conclude with a clear, unambiguous recommendation for the patient. Okay.
82 women comes to the physician because of 6-month history of frequent falls. Prior to each fall, she had a feeling of imbalance when walking or turning. She has never lost consciousness during these episodes. She has 5 year history of stable coronary artery disease and 10-year history of the osteoarthritis of the knee. Medications, aspirin and statin. She resides in an assisted living facility and has a bathroom with fixtures for elderly residents. Pulse is fine, respiration fine, BP a bit high, with no orthostatic changes. On exam, she has difficulty rising from chair. Her gait while using her cane is low, with instability on turns. Muscle strength 4 out of 5 in lower extremity. Which of the following is the next step in diagnosis? Hmm.
Mm,
This is crazy. This is complicated.
mm,
Where is it? Completely easy. Hmm.
imbalance when turning is like BPPV.
No, she's in. Oh, where is it? Imbalance when turning.
But he has difficulty. I think that like everything is good. Uh, Only problem he the fall.
Yeah, but she doesn't lose. Yeah, she falls, but she doesn't
She
lose.
never lost consciousness during the episodes.
So it
So
cannot be the heart because she never lost
yes,
consciousness.
maybe
Okay.
it's not syncope. There are three types of syncope, like reflux, orthostatic, and maybe cardiac. One of the cause. I think that uh,
Physical therapy.
yes,
Okay. Where is it? Yeah, you're
it's a
right.
very broad term, physical therapy.
Yeah.
Like the people of PMR does it, physical medicine and rehabilitation. Okay. This patient is demonstrating physical signs of normal age, including decreased muscle strength and balance, which are leading to frequent falls. The most appropriate remedy for this declining function is physical therapy, which will strengthen the patient and improve her coordination and balance. Other risk factor for mechanical falls this should be evaluated in elderly patients includes declining vision and cognitive impairment, medication adverse effect, arthritis, orthostatic hypotension, uh, though none appear to be present in this case. When evaluating a patient after a fall, it is important to understand the events leading up to the fall, including the patient activities at the time, whether prodromal symptoms such as dizziness were present, and whether the patient lost consciousness. If the patient lost consciousness, the underlying cardiac disease, orthostatic hypertension, neurologic disease should be investigated. The physician can also cause objective measurements to complete a global assessment of patient's risk, a test including a test in which the patient is timed when asked to rise from a standard armchair, walk across the room, turn around, and sit back down. The patient's performance and time to complete the task can help the physician and risk stratify the patients for their likelihood of the falls. Okay.
You read B, this one.
Yes. 24-hour ECG monitoring and duplex ultrasonography of the carotid artery. 24-hour ECG monitoring and duplex ultrasonography of the carotid artery may be may be indicated as a part of a cardiac or neurologic evaluation respectively if the patient fell because of a loss of consciousness of transient ischemic attack. However, the events surrounding these patients' fall indicate that they are more likely caused by the deconditioning and impaired balance. Okay.
32 women brought to the ED by her husband because of onset of shortness of breath, profuse, profuse sweating, and chest discomfort while at a concert 30 minutes ago. She had a similar episode 1 month ago while at her daughter's school play. She has felt anxious since that time and is concerned that she's going crazy. She has monitored her pulse during the past month and it has ranged from 70 to 80, so normal. Exam shows a pulse high, BP a bit high. An opening systolic click is heard over the left four intercostal space. What is the cause of her symptoms? Opening systolic click. Hmm. Sweating, chest discomfort, shortness of breath. Ugh,
The opening
hyperthyroid.
systolic click is that due to like sinus tachycardia, like,
Mm,
or
say opening
is it
it's like
actual
a
heart
yeah,
disease?
yeah, it's like a murmur. It's probably like mitral stenosis or something.
Mitral
No,
stenosis is left
no,
fifth
mitral
intercostal
stenosis.
space.
Wait, all physician
Mitral
take
stenosis has opening snap, and
yes,
it is in the left fifth intercostal space, not the left fourth intercostal space.
left fifth. All physician take. So it's mitral. Panic disorder.
So,
So is
oh,
she doesn't have any sign of hyperthyroid. Yeah, she does have sign of hyperthyroidism.
she has
Ah,
profuse sweating, chest discomfort, profuse sweating, anxious.
opening systolic click. I know we know it's not mitral valve. We know it's not paroxysmal. I don't think it's is
It is
it
not
paroxysmal
GAT.
at the
It is not hyperthyroidism, isn't it?
why is not why is
Hyperthyroid.
not God? Okay, because they say she's not concerned about nothing. She's just okay. Then I guess it's panic disorder.
Panic can cause
But
shortness of breath, palpitation. Sorry. Why
but if it's
tachycardia?
panic, why?
Like why opening
Yeah,
snap?
panic. Yeah, why opening snap? That's the part I don't get. That's why I think it's hyperthyroidism. But okay, why open? Oh my lord. Okay, fine. Let's just pick one.
Okay, maybe hyperthyroidism, maybe, or may not be.
No,
You are
no,
right.
it's
It's
panic.
panic.
Panic. Okay, okay.
Very confusing.
Yeah, that one is confusing.
There are no. I don't know why I pick hyperthyroidism. Okay. Panic disorder features panic attack that occurs unexpectedly and are associated with changes in behavior to avoid panic triggers. This patient is likely experiencing recurrent panic attack consistent with panic disorder. Panic attacks features acute fear or anxiety that peaks with minutes are mm, associated with four additional physical symptoms. Four additional physical symptoms are mental states. These additional symptoms may include heart palpitation, tachycardia, shortness of breath, chest pain, dizziness, the sensation of choking, GI distress, paresthesia, sweating, chills, trembling, derealization, and the fear of dying and the fear of losing control. Panic disorder is a relatively common psychiatric disorder characterized by recurrent panic attacks that are unexpected and that are unexpected are associated with uh, worry about future panic attacks or avoidance of panic attack triggers. Treatment typically includes psychotherapy, long-term SSRI, and short-term benzos. Okay.
Okay, can you read A, B, and E? A, B,
Yes.
E.
Generalized anxiety disorder features excessive and persistent worrying that may be associated with sympathetic hyperactivity. Panic attack may occur in generalized anxiety disorder, though anxiety symptoms are typically most constant and persistent compared to the episodic course of panic disorder. Hyperthyroidism can present with anxiety but is also associated with other characteristic symptoms and signs including but not limited to heat intolerance, palpitation, weight loss, hair loss, sweating, diarrhea, amnesia, oligomenorrhea, tachycardia. On physical examination, there is often discrete single palpable thyroid nodule, multiple nodule, or diffuse enlargement of the gland depending on the cause. And which one? C.
E.
Oh,
E.
paroxysmal atrial tachycardia manifests with acute symptoms, lightheadedness, pallor, diaphoresis, and syncope, but would more likely be accompanied by palpitation. Paroxysmal atrial tachycardia may be caused by structural defect in the His-Purkinje system, such as Wolff Parkinson White syndrome, and may be provoked by alcohol, nicotine, caffeine, or psychological stress. Okay.
Um, Next, you want to take a break?
Okay.